name is Victoria. I'm a nursing student at UTEP. I'm going to be performing a health assessment on you today. Is that okay?
Yes, that's fine.
Okay, so I'm going to go ahead and begin by washing my hands. And do you mind if I see your wristband, please? And can you confirm your name and date of birth?
My name is Isela Quintero and my date of birth is 12/7/51.
Thank you. So I'm going to go ahead and begin by asking you a few questions. Do you know where we're at right now?
Yes, right now we're at Providence Hospital.
Okay, and do you know the date and time?
Yes, September 26th, 3 p.m.
Thank you. Do you have any type of food allergies?
No, I don't. As a matter of fact, no.
Do you have any type of allergies to medication?
No.
What about seasonal allergies?
No. God.
And do you have a social support system at home, such as friends, family, basically anyone who would be able to assist you in daily activities if you were injured, for example?
Yes, I do.
Okay. Are you currently employed?
No, I'm retired.
Retired. And do you want me asking what type of religion you are associated with?
Catholic.
And do you mind me asking your race and ethnicity?
I'm Hispanic.
So now I'm going to go ahead and begin by taking your vitals. Are you in any type of pain today?
No, I'm not. I'm fine. Thank you.
So I'm going to begin by taking your blood pressure. If you want to go ahead and place your hand or your arm on this table. Thank you. And then I'm just going to go ahead and wrap this around your arm. And how are you doing today?
I'm fine. Just fine. Thank you.
Okay. Just go ahead and take your pulse. And you are going to feel a bit of pressure as I inflate. So your blood pressure is 88/81. Does that sound about right? Is that usually what you...
Yes.
Okay. Okay, next I'm going to go ahead and be assessing your temperature. Okay, and your temperature seems to be 97.2. That's good. And then next I'm going to go ahead and take your pulse. So if you want to go ahead and lend me your wrist, thank you. And I'm going to be assessing it for 30 seconds. Okay, so your pulse is 74 beats per minute. And next I'm going to go ahead and be taking your respiratory rate. So if you want to just relax, breathe normally, I will also be assessing it for 30 seconds. Okay, so no abnormalities found in any of your vital signs. They all seem to be within normal ranges, so that's good. So now I'm going to go ahead and inspect your skin. If you want to go ahead and face me, please. Okay, I don't note any any type of lesions, skin discoloration, edema, anything like that. Have you noticed any changes in your skin?
No, I haven't.
No changes in moles, new moles?
No.
Okay, so do you mind if I see your hand, please? I'm going to go ahead and assess for skin triggers, just for dehydration. Okay, and next I'm going to check capillary refill. So I'm just going to go ahead and press on your nails. Okay, so it seems to be within under 3 seconds, so that's good. I don't note any clubbing. Okay, so now I'm just going to go ahead and assess your hair. So let me just go ahead and put on my gloves. Have you noticed any changes in your hair?
No.
No? Loss of hair, anything like that?
No. No. Okay.
Check the other side. Okay, good. Okay, so now I'm just gonna go ahead and assess your face. Do one of you remove your mask for me, please? Yes, and your glasses. Okay. Next, I'm just gonna go ahead and ask you to open your mouth for me, please. Go ahead and lift your head up. Okay. Thank you. And I'm just gonna go ahead and palpate the temporal arteries. Okay. Next, I'm gonna go ahead and assess cranial nerve number 9. So if you want to go ahead and face me one more time, please. And then you're just gonna go ahead and open your mouth and say ah. Go ahead and tilt your head up for me, please. Thank you. And then if you want to just go ahead and swallow for me, pretend like you're swallowing. Thank you. So cranial nerve number 9 and 10 seem to be intact. And then just for cranial nerve number 12, you're just going to go ahead and stick out your tongue for me and move it left to right and then up and down. Perfect. Thank you. Now we're going to be assessing cranial nerve number 5. So just go ahead and look straight ahead at the author for me. And I'm just going to be coming in at the sides with the cotton ball. Good, thank you. Now I'm going to go ahead and do the other side. Good, thank you. Okay. So next, I'm just going to have you close your eyes for me. And I'm going to go ahead and pick out your face with something sharp and soft. And you're just going to tell me if it's sharp or soft.
Sharp. 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 Soft. 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 Soft.
Good, thank you. Okay, and then now I'm going to ask you to bite down really hard. And I'm just going to place my fingers right here. Okay, now open your jaw really wide. Good, thank you. Okay, now I'm going to place my hand under your chin. You're just going to try to open it for me, okay? Go ahead and open your chin. Good, thank you. Now I'm going to hold your chin. You're going to try to move your jaw from left to right. Good, thank you. Does that hurt? Do you have any pain when you do that?
No.
No? Okay, good. So cranial nerve number 5 seems to be intact. Now I'm going to go ahead and be assessing cranial nerve number 7. So if you want to just go ahead and squint your eyes for me really tight, please. Okay, and then just go ahead and smile. Frown. Puff out your cheeks. Good, thank you. So cranial nerve number 7 seems to be intact. Now we're going to go ahead and assess cranial nerve number 11. So if you want to just move your head up And down for me. And then just side to side like this. Good. And then I'm just going to ask you to lift up your shoulders. I'm going to add pressure and resistance. Good. Thank you. So cranial nerve number 11 seems to be intact. Now I'm going to go ahead and assess the range of motion of your temporomandibular joint. So what I'm just going to do, I'm just going to place my fingers right here. And you're just going to try to open your jaw for me. Thank you. Did you feel any pain at all?
No, not at all.
Okay. So then next, I'm just going to go ahead and inspect your neck. So if you want to just go ahead and lift it up for me. Okay. And have you noticed any type of swelling in your neck area?
No.
No? Okay. And next, I'm just going to go ahead and palpate your trachea. If you want to go ahead and lift your neck up for me, please. Good, thank you. Okay, so I'm going to go ahead and assess the range of motion of your neck. So if you want to just go ahead and try to move it in a circular motion like this for me. Okay, and then just go ahead and try to bend it side to side. Okay, move it up and down. Do you have any pain at all?
No.
No? Okay. Okay, so next I want to go ahead and assess your lymph nodes. So if you want to just go ahead and face me, please. Okay. So, okay, so preauricular. And while I'm doing this, go ahead and let me know if you have any pain or tenderness.
Okay.
Preauricular. Postauricular. Tonsillar. Submandibular. And submental. Anterior cervical. Posterior cervical.
I'm doing fine with no pain.
Okay, good. Deep cervical. Okay. Supraclavicular. Infraclavicular. And then occipital. Good, thank you. Okay, so now I'm going to be assessing your eyes. So I'm just going to go ahead and take a look here. Okay. I want to go ahead and shine the light in your eye. It's going to be kind of bright. Okay. Have you noticed any discharge, anything like that from... Oh, wait, I messed up. Sorry. Hold on. Start over. It's not that far. Okay, sorry. Okay. Okay, so now I'm going to go ahead and assess your eyes. I'm just going to go ahead and take a look. Okay, so next I'm just going to go ahead and pull up your upper eyelid and just go ahead and look down for me, okay? Okay, so nothing abnormal with the conjunctiva. Have you noticed any discharge, anything, any problems with your eyes lately?
No.
Okay. So next I want to go ahead and be assessing cranial nerve number 2. So for this one, I'm just going to go ahead and ask you to cover your left eye for me, please. So now I'm just going to hold up fingers on the sides, and you're just going to tell me how many fingers I'm holding up, okay?
2, 3, 4, 1.
Good. Okay, next slide.
1, 2, 3, 4.
Good, thank you. Okay, and do you wear glasses?
Yes, I do.
You do? Okay. Do you use them to read near or far?
Near.
Near? Okay. So next I'm going to have you face forward, and we're going to go ahead and read the chart. And then just go ahead and cover your left eye for me, please. And then which line is the smallest line you could read without straining your eyes or squinting?
A, C, D, L, F.
Good, okay. And then go ahead and do the next way. Same thing.
ACDLF.
Good, okay, so 20/20 vision. And then if you could place your glasses on for me now. And I'm just going to give you something to read. If you could just read that line for me, please.
The monkey fell out of the tree.
Good, thank you. Okay, so cranial nerve number 2 seems to be intact. So now we're going to go ahead and assess cranial nerve number 3. So for this one, if you want to go ahead and face me again, please. So for this one, you're just going to go ahead and keep your head still. And you're just going to follow the pen line with your eyes, okay? Good, thank you. So cranial number 3 is intact as well. So for cranial nerve number 4, you're just gonna go ahead and focus on the object far ahead. And I'm just gonna go ahead and shine the light in your eye one more time. If you could just remove your glasses for me, please. So once again, it's gonna be a little bright. So just go ahead and focus on the object. Good, thank you. So cranial nerve number 4 is intact. And then for cranial nerve number 6, you're just gonna go ahead and stare ahead. And then when my pen light's coming into your face, just go ahead and focus on it, okay? So I'm gonna move it in towards your nose. Good, thank you. So cranial nerve number 6 is intact. Okay, so now I'm gonna go ahead and assess your nose. So I'm just gonna go ahead and feel it a little, okay? Is there any pain or tenderness?
No.
No? Okay, and then I'm just gonna have you tilt your head up and I'm just gonna shine the light in it, okay? Have you had a runny nose lately?
No.
No? Have you had any nosebleeds?
No.
No? Any changes in your nose? Smell?
No.
Okay. So now I'm gonna go ahead and assess cranial nerve number 1. And then for this one, I'm just gonna go ahead and put a familiar smell in front of your nose, and you're gonna close your eyes and you're gonna tell me, or you're gonna try to identify the smell, okay? So go ahead and close your eyes. Okay, and tell me what you smell.
Alcohol?
Okay, good, thank you. So cranial nerve number 1 is intact. Okay, so now I'm gonna go ahead and assess your ears. Have you had any type of liquid or discharge from your ears lately?
No.
Okay, I'm gonna go ahead and feel them. Is there any tenderness?
No.
No ear pain as well?
No.
Okay, I'm gonna go ahead and just shine my light inside your eye, or your ear. Okay. So now we're gonna go ahead and assess cranial nerve number 8. So with this one, we're gonna be doing the whisper test. So what I'm gonna do is I'm just gonna go ahead and stand behind you, and I'm just gonna whisper a word, and you're just gonna repeat that word back to me, okay? And let me know if you have difficulty hearing the word.
Apple?
Good.
Banana?
Good, thank you. So cranial nerve number 8 is intact. So next we're gonna go ahead and do the Romberg test. So if you wanna just go ahead and stand up for me, please. Okay, there you go. And then just face forward. So what you're gonna do is just close your eyes, and I'll be here in case you get dizzy or if you feel like falling, anything like that. You're just gonna close your eyes and then just try to balance. And then you're also gonna hold your hands up in front of you, okay? Ready? And if you wanna just hold your hands up in front of you. Good. Good, thank you. Okay, you can go ahead and sit down for me. Okay, so now I'm gonna go ahead and be listening and auscultating your lung sound. So if you wanna just go ahead and face me, please. So each time I move my stethoscopes to a different area, if you just wanna breathe in and out for me, okay? Just normal breaths. And while I'm doing this, if you get dizzy or anything like that, just go ahead and let me know and then we can slow down or take a break.
Okay.
Good, thank you. And I'm just gonna go ahead and assess your back. And then I'm just gonna go ahead and lift your shirt up a little bit, okay?
Okay.
Just I'm gonna check for any lesions, anything like that. Any pain or tenderness?
No.
Okay, same thing. I'm just gonna go ahead and listen to your lungs. Just normal breaths. Okay, thank you. Okay, so I noticed normal breath sounds, rhythm, rate, no abnormalities. Okay, so now I'm just gonna go ahead and inspect your jugular veins. Okay, you want to tilt your head to the side for me, please. Thank you. Now other side. Good, thank you. And then I'm just gonna go ahead and feel them. Good, thank you. So now I'm just gonna go ahead and palpate your carotid arteries. So I'm gonna go ahead and do one at a time. Okay, now the other end. Good, thank you. Okay, so now I'm just gonna go ahead and palpate landmarks of your heart. So if you want to face me, please. Okay. And no girls were noted for jugular vein distension or for the jugular veins. Okay, so I'm going to begin with the aortic. Pulmonic. Herbs. And tricuspid. Okay, and then for mitral, the apical pulse, you're just going to go ahead and lift your breast up everything. Thank you. Thank you. So now I'm going to go ahead and begin listening. Apical. Pulmonic. nerves. Tricuspid. And then same thing, if you could lift your breast up for me, please. Mitral. Thank you. Okay, so now I'm going to go ahead and ask you to sit for me right here, please. Okay, I don't see any edema, normal color of upper and lower extremities. Now I'm just going to go ahead and palpate your pulses. So if you want to go ahead and lend me your elbow, please. Okay, brachial. 2 plus. Radial. 2 plus. Femoral. So for this one, you're just going to go ahead and open your legs just a little bit. I'm just going to feel right here, okay? 2 plus. Okay. And then if you want to just, there you go, thank you. Popliteal. Thank you. And then, I'm sorry, pedis dorsalis. And then posterior tibial. Good, so all the pulses are within normal range, they're 2 plus. So now we're gonna go ahead and do the abdominal assessment. So for this one, I'm just gonna go ahead and ask you to lie down for me here, please. And there's no one else in the room, so we have privacy. And then, so now I'm just gonna go ahead and ask you to lift your blouse up for me, please. Just, there we go. Okay, so normal color, no lesions, no abnormalities. I do notice that you have a scar. Do you mind me asking what the scar is from?
Yes, they're cesareans, 2 cesareans that I had.
Okay, how long ago did you have the procedures?
Okay, one of them like 46 years ago, and the other one about 43 years ago.
Okay, have you had any pain in the area?
No.
No? Okay, so now I'm just gonna go ahead and auscultate the abdominal. So I'm just gonna go ahead and be listening with my stethoscope, okay?
Okay.
So I'm gonna go ahead and begin at the right lower quadrant. Going clockwise. Okay, good. So now I'm just gonna go ahead and palpate your abdominal. So I am gonna apply light pressure. Go ahead and let me know if you feel any pain, tenderness, anything like that, okay?
No, fine. No. Okay,
Okay, good.
fine.
Okay, so now I'm gonna go ahead and go a little bit deeper. Same thing, let me know if you feel any pain or tenderness.
No. No. Nope. No.
Good, thank you. Okay, so now I'm gonna go ahead and perform rebound tenderness. So I'm just gonna go ahead and apply pressure. Let me know if you feel any pain, and if you do feel pain, let me know if you feel it as I'm pressing in or as I'm letting go, okay? Okay?
No.
What about now? No?
No.
Okay, got it. So now I'm just gonna go ahead and ask you to stand up for me, please. And then if you wanna go ahead and stand right there. And you're just gonna take a few steps up till you get up to me, okay? Thank you. Okay, now you can just go ahead and sit down for me here, please. Okay, so normal gait, normal body symmetry, normal posture, and no deformities. Okay, so now I'm just gonna go ahead and palpate your shoulders, elbows, and hands. Let me know if you feel any pain or tenderness while I'm doing this.
No pain at all.
Okay, raise your hands. Okay, good. So now I'm going to go ahead and assess the range of motion of these areas. So first, you're just going to go ahead and lift your hands up. Okay, and then just go ahead and place your hands behind your head. Okay, and then just put your hands across your chest. Okay, and then go ahead and place them on your shoulders. Okay, and then you're just going to place your arms in front of you, and then move your wrists down. Open your fingers. And then just make a fist. Good, okay, thank you. Okay, so, and then if I could just see your hands, please. Just testing your range of motion of your fingers. Any pain?
No.
Other? Okay. So now I'm also going to be testing the muscle strength of these areas. So if you want to just go ahead and squeeze my fingers. Okay, thank you. And then now I am just going to grab your hand and I'm going to go ahead and push against you and you're going to try to resist, okay? Good, and then same thing, just opposite. Good, thank you. Okay, so now I'm just going to go ahead and palpate your hips, knees, and ankles. Let me know if you feel any pain or tenderness. You took that? I'm sorry. It's okay. Okay. Now just your knees. Any pain, tenderness?
No.
Okay. I'm just gonna palpate your ankles. Thank you. Now your feet. Good, thank you. Okay, so now I'm also going to be testing range of motion of these areas. So if you could just try to lift your knee up like this. Okay, and then the other one as well. Okay, and then just try to open your knees, or your hips open. Okay, and then just join them together like this. Good, thank you. Okay, and then if you want to move your, the bottom of your leg back like this. Good, and then just other leg. Any pain while you do this?
No.
No? Okay. Okay, and then you're going to go ahead and lift your leg up, and then you're going to be moving your ankle up and down. And then side to side. Any pain? And then the other one as well. Thank you. So now I'm going to go ahead and be assessing muscle strength in your lower extremities. So I'm just going to go ahead and apply pressure and resistance, and you're just going to try to lift your thighs up, okay? And then we're going to do this with your calves and feet as well. So go ahead and try to lift up your thighs. Okay, and then try to open your thighs. Okay, now try to close them. Okay, now let's move with your calves. So go ahead and try to open them. Okay, try to close them. Try to push them forward. And then try to move, push them back. Good. And now we're gonna go ahead and do your feet. So go ahead and lift up your legs. There you go. Try to go ahead and bend forward. Okay, bend back. Try to open them. And then just try to close them. Good, thank you. Okay, so now I'm gonna go ahead and be assessing your spine. So if you wanna go ahead and stand up for me, and then just stand right there for me, please. Okay. And then if you could please just lean back for me, please, as far as you can. Okay, and then just go ahead and straighten out for me. And then you're just gonna move side to side. Good. And then next, you're just gonna go ahead and lean forward. And I'm just gonna go ahead and lift up your blouse, and I'm just gonna assess your spine, okay? Just gonna go ahead and feel it. Okay, good. And then if you could just have a seat for me, please. Okay, so that wraps up our health assessment. Do you have any type of questions for me? Any concerns that you would like to address?
No, I'm fine.
Okay,
Everything
okay.
was
So everything
perfect.
came
Everything
out
was good.
good. Okay.
Yes.
So everything came out normal, no abnormalities. So you seem to be in good health, so that's good. And then yes, that just completes our health assessment.
Thank you.